ENSEAL X1 Tissue Sealer. Indications. The ENSEAL X1 tissue sealers are bipolar electrosurgical instruments intended for use in open or laparoscopic surgical procedures for vessel ligation, as well as cutting, grasping, and dissecting tissue. These devices can also be used in any procedure where the division of vessels, lymphatics, and tissue bundles is performed. They are available in both curved and straight jaw configurations. Indications for use include open and laparoscopic general, colorectal, gynecological, bariatrics, thoracic, urologic, and ENT surgical procedures. Device description. The ENSEAL X1 tissue sealer is a sterile, single-patient use surgical instrument used to coagulate and transect tissue, vascular bundles, and vessels up to and including 7 millimeters in diameter. The instrument consists of a movable jaw, 360-degree rotating shaft, separate seal and cut buttons, closing handle, and grip housing assembly with attached power cord. The power cord is permanently attached to the device. The ENSEAL X1 tissue sealer instrument is designed for use exclusively with the Ethicon Generator G11, Gen 11, software version 2016-1 or later, packaged separately. The instrument shaft can be rotated 360 degrees to facilitate visualization and enable easy access to targeted tissue. The jaws are in a normally open position and can be partially or fully closed by squeezing the closing handle. The jaws are designed for grasping and holding targeted tissue when clamped. The lower jaw of the ENSEAL X1 tissue sealer can be used in the open or closed position to deliver bipolar energy when the seal button or the min foot pedal is pressed. Pressing the cut button advances the knife to the end of the knife slot to cut the targeted tissue. Instructions for use. Using sterile technique, remove the instrument from the package. To avoid damage, do not flip the instrument into the sterile field. Connect the instrument power cord to the generator and turn the generator power on. Close the jaws by squeezing the closing handle and insert the shaft through a trocar or incision. Prior to squeezing the closing handle, check for objects such as surgical drapes, gowns, and/or patient tissue that could get caught between the closing handle and the grip housing of the device. Failure to do so may result in patient injury, loss of sterility, and/or impaired device functionality. Once the instrument is inside the patient, squeeze the closing handle until it unlocks to open the jaws. Turn the rotation knob to move the shaft around to the desired position. Position the vessel or tissue in the center of the jaws. Do not overfill the jaws or grasp tissue beyond the electrode surface in the hinge of the jaws. This could result in difficulty opening the jaws, partially cutting tissue, and unintended injury. Squeeze closing handle until it latches and a click is heard to clamp the targeted tissue between the jaws. Relax grip on closing handle once it is latched. Once the handle is latched, it will remain latched until it is squeezed again. The instrument is now ready to seal. If the closing handle is not fully latched, this may result in improper sealing and thermal spread. Do not turn the rotation knob when the closing handle is latched. This may damage the device. To reduce the possibility of an inadvertent activation of the sealing mechanism, do not place your finger on the blue seal button until the jaws are in the desired position and activation is intended. Avoid placing tension on the tissue when sealing or cutting to ensure adequate hemostasis. Once the jaws are in the desired position, press the blue seal button or min foot pedal to energize the jaws and begin coagulation of the targeted tissue. The generator gives audible feedback as energy is delivered to the clamped tissue. Continue to depress the blue seal button or min foot pedal until the activation cycle is complete and a second tone is heard, indicating energy has been stopped. Release the seal button. If transection of tissue is desired after sealing, wait for the end tone before pressing the cut button. If the knife is advanced prior to hearing the end tone, it may result in incomplete sealing or lack of hemostasis. Fully depress the cut button against the grip housing. The knife will advance to the end of the knife slot and retract once the cut button has been released. After the transection cycle is complete, Squeeze the closing handle until it unlocks to release the tissue. To remove the device, close the jaws by squeezing the closing handle. Then remove the device from the trocar or incision. Cleaning the device. For optimal performance and to avoid tissue sticking, clean the instrument jaws and distal end of the shaft with a sterile, moist gauze sponge throughout the procedure. If possible, support the end of the shaft with one hand while cleaning to help prevent inadvertent damage to the end effector. If tissue is still visible in the jaws, use forceps to remove residue, taking care not to actuate the instrument. Do not clean the instrument with abrasives. Do not immerse distal tip in liquid, including saline solution, to clean. This may result in damage to the instrument. Do not activate the instrument while cleaning to avoid inadvertent user injury. Post-procedure. Disconnect the instrument from the generator. Dispose of the instrument and its integrated power cord in an appropriate sharps container.